Tuesday. It happens to be the 25th of February and the year is 2025. My name is Oraku Benson Pastore, back on the lenses of West Nile Television to give you what continues to transpire in the news. As usual, first take a look at the headlines before I bounce back to give you the news into details. Coming up in the news headlines tonight, UNICEF launches maternal and child health drive in West Nile region. Health Department in Papati takes steps to fight malaria. Last week, GTS schools for SP educators in West Nile region. Details about this in Lancaster News. Back from the headlines, now straight into the details of the news. UNICEF launches maternal and child health drive in West Nile in the proposal to promote maternal health care to save lives of both the Banda and the unborn baby in Uganda. UNICEF has launched a campaign called I Am Her Keeper to promote healthcare access by expectant mothers in West Nile region. Ture Joseph reports about that.
The Ministry of Health, in partnership with the United Nations Children's Fund, UNICEF, have launched a 5-year maternal and child health program dubbed I'm Her Keeper campaign in West Nile. I'm Her Keeper campaign is a program that is promote the access to antenatal health care by the expectant mothers with support from their spouses.
The campaign is to raise awareness and improve on the uptake of the ANC services in all facilities. Uganda in general actually has not been doing well in terms of their cases of maternal and newborn deaths in the area of facility delivery.
We have seen actually that pregnancies where men support their wives end up very well, and actually the outcomes are so good even up to the time of giving birth.
Victor Fayo, a gynecologist, has encouraged the men to be fully responsible in taking part during the antenatal care programs to reduce on the rates of maternal and child death cases in West Nile.
I would like my counterparts, the men, to really join hands with their wives and ensure that we carry on this one together. And that's why we're saying, I am her keeper. And therefore, being her keeper starts from you, and let the community or family members see it from you as the man. And we do this together, and the joy definitely at home there will be to everyone.
Dr. Ronald Miria Ochatwe, the Assistant Health Commissioner in charge of Health Promotion and Strategic Health Communication. Dr. Ronald Miria Ochatwe, the Assistant Health Commissioner in charge of Health Promotion and Strategic Health Communication, stated the beauty of male involvement in antenatal health care of their expectant wives.
If the mother goes alone and she's given all those educative information without the man who actually controls nearly all the resources in the family, getting to know exactly what this woman is supposed to do and how she's supposed to be helped, then we are actually not doing much. But when they come as a couple, definitely we try to counsel them. We counsel them, and specifically the man who controls most of the resources, that this woman from time to time may need to prepare for birth, because birth preparedness plan means there are certain things the mother needs to have, and things like good clothing, the baby towels, those things for the baby and also for the mother. Those are things that need to be prepared, and it needs money.
Ochatwe has noted with concern that over 180 lives are lost across the country on daily basis. He, however, has called upon the media fraternity to closely follow and publish the progress of healthcare.
As a country, we stand at 189 mothers dying out of 100,000 live births that we register as a country. And definitely districts have specific variations. The DHOs can actually tell you how many mothers they are losing out of 100,000. We want to call upon the members of the media to be able to join hands with the health sector to be able to carry out our messages. We can't be everywhere, but we know just one message from a media house will reach thousands and maybe hundreds of thousands.
According to the 2022 National Institutes of Health report, Uganda is among the sub-Saharan countries with a very high maternal mortality ratio, estimated at 336 deaths per 100,000 lives. Joseph Chura reporting.
Still keeping it within health sector, now in Pakwati district, health department in Pakwati district takes steps to fight malaria by training health officers from Pakwati district in malaria prevention strategies during a 2 days training of the trainers at Pakwati district health boardroom today. Alfred Jawok compiles about that.
The Ministry of Health has taken a proactive step in combating malaria by training health officers from Pakwati district in malaria prevention strategies during a 2 days training of trainers at Pakwati district health boardroom today. Beatrice Nakaiza, team leader from the Ministry of Health, said the initiative is part of the government's effort to reduce the burden of malaria, which remains a significant public health concern in the country.
Immunization schedule for malaria introduction. I don't know whether they have another introduction they are going to conduct, but while we are saying under 5, we say there are some children who are going to be brought, not as scheduled. We don't say let's start district with 6 months, no. Let that child come, give the first dose at the age the child has come. But with that interval of 1 month, and then another one, 6 months.
Moses Arake Dalele, Chief Administrative Officer, Pakwati District, noted that the training program is to enhance capacity building of health officers in malaria prevention methods.
You will be able to learn the story of the day of Mukale, the Pakwati Health Center 4. Pakwati Health Center 4 could be benefiting from those in category 3. Maybe they are referring. Maybe they are referring and then they come and manage them. But let us learn those stories that are good, that help them to improve, so that we don't have the challenge of having many of our people not doing the night.
Robert Omitostin, Pakwati District Chairperson, asserted that understanding the importance of using insecticide-treated bed nets, indoor residual spraying, and other preventive measures can be one of the measures to prevent malaria in the district.
Don't drag, because the impact, like what the line, for example, we had what was going around. Resolving that dragged so much. It dragged so much. And it starts with all these people I know. In every office where you're hearing a lot of tension, it is greed. It's just greed on sharing resource. Nothing else.
Judith Kigezi, who represented Pakwati District Health Officer, emphasized the need for early detection and treatment, learning how to identify malaria symptoms, diagnose the disease, and provide effective treatment.
Round buildings, open if before you know it, the mosquitoes are there. We know that they also fish, and when they go to fish, they don't carry their nets in the boats, right? So we are going to have to talk to these communities. It is a mindset change that will allow somebody carrying an intervention that can supplement those other ones. So for me, that is my submission. And my worry was that, yes, we are on the list. The other time, indoor residue, we were there on the list. Before we knew it, we were eliminated. So we pray we really remain on the list. Thank you.
By empowering health officers with the knowledge and skills to prevent and manage malaria, the Ministry of Health aims to reduce the incidence of malaria in Pakwach and other affected areas. Alfred Jawok, Camilla Stansha, West Nile TV, Nilecast.
Now turning the bus and driving to Arua City, Uganda Girl Guides Association skills 40 SP educators in West Nile, where they were equipped with a number of skills SP educators with the aim to positively transform their communities. Farsi Majid reports about that.
As the number of young people, most especially adolescents, struggling with a number of challenges ranging from menstrual health, sexuality and peer influence among others is on the rise in the country, Uganda Girl Guides Association, a non-government organization focusing on advocacy, has trained 40 young people as peer educators in the region To help address the concern, the 3 days peer educators training took place from Zara Hotel in Arua City from the 19th to the 21st of February 2005. Premier Immaculate Cynthia from Awindri Ward in Arua City, who is among those that got trained, is grateful for the opportunity and expresses readiness to positively impact on her community.
As me myself, I've never been a peer educator in my life. This is my first time, and I've learned a lot of things. How to change the environment from doing bad things, how to talk to my peer groups. We learned about the violation of children's rights, how we can prevent them. We have learned a lot of things. And now we are set to go out to the communities. Like me, I'm being sent to Ariru Sub-County. I will be traveling to Ariru Sub-County to talk about children's rights, to assemble these children, make sure they know their rights and their rights are not being abused by other people.
Relatedly, Odipio Charles, another beneficiary of the training from Ivory West Division Arua City, who is now empowered by the knowledge, is looking at extending the skills to fellow youths, most especially in areas of freedom of speech and expression.
We came to realize that some of our parents are really affecting the progress of young people's communication in a way that they don't want to give them chance to express themselves. For instance, in our city here, you realize that young people may have something to advocate for, but now as parents, we don't want to give the freedom for them to express themselves. So for that matter, we have been in impact with the knowledge to go out to actually advocate for this. From now, we are going to go viral to ensure that young people have been given this freedom and the opportunity to express themselves, such that any issue that is touching them as young people, it should be addressed.
Meanwhile, Masula Chache, who works as the program finance and administration with the association, highlighted some of the areas in which they train the young people as this.
As we do this advocacy work, we've empowered them with skills on child-friendly spaces. We've given them knowledge on school and community engagements, so that as they work with the different stakeholders, they're able to empower the children and also empower the communities. We need the parents, we need the religious leaders, we need the local leaders to support our peer educators, because they will come to you looking for help on how to reach out to the children and the schools.
Namarame Susan, the Chief Commissioner of Uganda Girl Association, however, asked the persons who got trained to extend the knowledge to those who didn't have the opportunity, so as to positively impact on their communities.
I want to say congratulations. And on top of that, like Jesus said, when he trained the disciples, he set them out and told them to go and do the multiplication. Is that true? Yes. So now I also say, for what you have got, go out and multiply. If you came one in your area, make more disciples of the peer educators of 10. And the 10 will make more 10. And then we shall multiply and be of value and of impact in our city, Arua.
The young men and women were selected from the districts of Arua, Yumbi and Arua City, where they were trained with a number of skills as peer educators with the aim of positively transforming their communities. Farish Majid, reporting for West Nile TV, Nalcast.
Moving to education sector, from Acholi line, particularly in Nyoya district, best PLE leavers from Nyoya district get scholarship from Total Energies ESP, Julian Lanyero, one of the top performing girls in the 2024 PLE, and 20 girls from both Nyoya and Bulisa districts have been provided with opportunities to pursue their secondary education without financial challenges. Stephen Okello gives us details about that particular story.
During her 7 years in primary schools, Gillian often missed classes as she was sent home due to unpaid school fees.
I feel very sad. I was very ashamed from school that they were chasing me.
Her passion for education and dream of becoming a medical doctor remain unwavering despite the family financial struggles.
I want to be a doctor because doctor can help sick people, they can treat them.
The stress of her uncertain future even took toll on her mother's health. Despite enduring financial hardship, missing classes, and facing mockery from fellow pupils for borrowing notes, Gillian remained determined to excel.
I was very happy about my result. Instead of the one I got,
Gillian's mother, Christian Ajok, was overwhelmed with joy upon learning that her daughter was among the district top pupils. Initially, she had lost hope due to a family struggle, particularly as Gillian's father, the primary breadwinner, battled diabetes. Just as the family had nearly given up, hope was restored when Gillian's name appeared on the Total Energy E&P Uganda scholarship list.
Many people applied, but we took that green, that 10. So if you're here, you're special, so congratulations.
While addressing the 10th selected beneficiaries, NILE District Chairman Emmanuel Raj urged the girls to remain focused and maintain their academic performance.
The schools we're going to have got so many children, some for the very rich people who are able to pay. School fees your parents could not pay. That means different teachings, different upbringings. There is need to see how we are going to integrate with them.
Total Energy E&P Uganda is offering full scholarship to 20 girls from both Nuaya District and Bulusia District, providing them with opportunity to pursue their secondary education without financial burden.
May you be blessed in your studies.
Stephen Okello for West Nile Television, Nilecast.
Now moving to the world of sports, more especially in West Nile Regional League, there was a game played over the weekend in West Nile Regional League Nyagak Zone between Paida United and the team of Arue Central Football Club. In the process, Paida United humiliated Arue City Football Club by 3 goals to 0. First, take a look at how the highlights of the story was compiled.
Over the weekend, Paida United Sports Club rang up the curtain in their second leg of the regional league journey with a comfortable 3-0 win over visitors Arua City FC at King Stadium Chana in Paida Town Council, Zombo District. The Zombo-based club started the game on high note, salvaging an early goal in the first half of the game, with Ronnie scoring an early goal in the game. As the game geared towards the end of the first half, veteran striker Ronnie was set by midfielder Pogba, only to be brought down at the edge of the box, giving United a free kick that never materialized. Robert Orombi, the technical manager of Paida United Sports Club, praised his winning side, adding that upon recently tapping in 4 quality players, they are destined for big league next season.
It is what we have been praying for, and it has happened. So we are eyeing the top position because Nile Zone, we want to take over. Nagat Zone, we want to be number 1, and our focus is on going to play off. And after playoff, we are going to big league. Because my boys, what I realized in the previous seasons, second half or second season would be difficult for us. But we have backed up our second season with the four more new signings. So we are going ahead. The first game, the win, we appreciate and we are giving God the glory for giving us the victory. Our next game, we are going to Kuluva and we want to win that game. After that, our focus is first position. Thank you.
Meanwhile, the head coach of Arua City, Saidi Aloro, lauded his boys for playing their heart out amidst fatigue and absence of key players who have returned to school.
Challenges that led us to come alone because we couldn't carry the whole team. The transport means was small, but we have their support back at home. That's why we came. A couple of them to school, and most of the players have gone back to school. that also affected the talent of the players, which obviously affects the team. One way or the other, the game has to be.
Either United will travel over 50 kilometers away to Arua district to face Ovisioni FC next weekend. In another regional league, the table leader Nebi Central salvaged 3 points from Ovisioni in Arua district. Meanwhile, Arua Airfield played 0-0 with Pakwach Young Stars. Alfred Jawok, Camilla Stansha, West Nile TV, Nile Cast.
Before I leave the studios, I need to also give you the highlights of how things went in Stanbic Uganda Cup round of 32. There was a very big encounter in Arua district between Kasasiro Boys and the team of Kuluva Rainbow. In the process, it ended by 2-1 in favor of not Kuluva Rainbow, KCA. And more details about that game will come tomorrow. And that side of Pakwati district, there was also a game between Pakwati Youngsters and UPDF. The full time of that game ended 0-0. Then in the penalty shootout, it ended by 8-7 in favor of UPDF. With that, we have come to the end of today's edition of Nilecast News. It has been me, Benson Pastore, in front of the camera. Let's link up again tomorrow.